Hi everyone. My name's Christy Gerard, and I'm BetterMynd Senior Director of Campus Success. Hi Amanda. Hi Zupenda. Um, what I want to share is that I really enjoy this work because it's so important that students have access to the resources they need to be successful. And I get to work with so many folks in higher ed that actually get to do this important, impressive work. But today is not about BetterMynd. It is about the innovative work that you do on your individual campuses. And today we are going to dive into a case study from West Virginia, a state that has taken bold, flexible approaches to scaling student mental health across a diverse range of campuses. I am joined today by a wonderful panel of folks: Dr. Candace Lane from the West Virginia Higher Education Policy Commission, along with Anna Hardy at Concord University and RJ Cantor at West Virginia Northern Community College. The goal today is to keep things conversational and real. We should feel like this is useful and empowering, not just a webinar with big talk and no takeaways. And we're not talking about one size fits all models. It's about hearing what's actually working for different institutions. So please keep your questions and comments coming in the chat. And we are going to dig into how 8 West Virginia institutions are delivering flexible mental health support, how campuses are tailoring these services to fit their unique contexts, and real results and campus insights you can use. Plus, we have some time for your questions. But first, I actually want to kick things off with a poll for everyone. And you'll see that pop up on your screen in just a second. What we're hoping to learn, and there it is, yes. What we're hoping to learn from you is, what are your biggest barriers to supporting student mental health at your institution? This can be very individual. It can be, exactly what you are facing today. And these are some general things that we see across the board at not only our campus partners, but higher ed in general. So give people a minute to put their answer to the poll in. Okay, great. While people are filling that out, I'm going to talk a little bit about what the data is telling us. We are seeing, and you all probably know this to be true, that emotional stress and personal mental health are the top 2 reasons that students stop out from school. Not only is this the reason, but they are actually recognizing it and naming it now. So let's check on our poll results. Okay, let's see. Does that line up? Yeah, 25% limited budget, 22% difficulty supporting off-campus commuter athletes or online students. Yeah, staffing shortages, low student engagement. We're actually going to speak to a lot of these things today, and the folks on this call definitely can speak to some of those concerns. So many institutions are prioritizing ensuring that the services are available. So that's what we can see here, is that resources are being available to address the need, and many of you today are probably tasked with doing exactly that. However, there is still a disconnect between availability of services and student awareness, and then a further drop to utilization. And I mean, real talk, this is hard work. For those of us that are here today, it's about ensuring that we are meeting students where they are, building their trust, and leading to actual utilization of services that you've worked so hard to bring to your campus. So here at BetterMynd, we know that all modalities of mental health services help students, whether it's in-person counseling, online counseling. All of these things help students. How we fit in is we offer flexible online options to support in-person counseling services by acting as an extension of our campus partners. Or for those without an in-person center, we're able to speak your unique campus's care philosophy to your students. And we do this with individual 50-minute counseling sessions, psychiatry, a 24/7 support line, and group well-being workshops. This allows each campus to meet each individual student's need with a variety of resources. We're proud to partner with more than 150 institutions across the US, large flagships, community colleges, and all the other institutions in between. And really, what makes BetterMynd different is the ability to meet institutions' needs as well as student needs. We know that 64% of students are not using services. So that allows you to tailor support to individual students' need and support a different range of care. That means, like, if most students are going to use 0 sessions, you can allocate more to the smaller group that needs more. You can see from this data that our partners see a range of care anywhere from 1, which is the vast majority, up to 40. So it's really up to you to decide how you can meet your students and provide support to them. How we do this is campuses purchase a bucket of credits that meet their needs and budget. They allocate those resources to their students, and these little dots represent how many sessions are allocated to each individual student. And then we only deduct what's actually used. So anything that is left over rolls over into the next year, which just eliminates the waste of resources. So that's it. Let's just get into it. I'm excited to introduce our panel of leaders who represent every side of this initiative, from statewide strategy to on-the-ground campus leadership. First up is Candace Lane, the Behavioral Health Program Specialist for the West Virginia Higher Education Policy Commission. Candace has been leading efforts to shape a statewide mental health response that meets the needs of students everywhere, regardless of their campus size or location. Anna Hardy is the Chief Student Affairs Officer and Dean of Students at Concord University. And Anna brings the perspective of a senior leader at a 4-year institution, one that's using our flexible model to complement their existing counseling services and extend support to even more students. And finally, Raymond R.J. Cantor is Associate Professor and Mental Health and Wellness Committee Chair at West Virginia Northern Community College. RJ is a faculty champion on a campus without an on-site counseling center, and he's driving engagement and trust in new mental health resources through creative collaboration and outreach. So I'm just really appreciative of all of you for being here and for sharing your stories. I think we would love to start with learning about the state level perspective. So Candace, can you tell us why student mental health is rising to the top of campus priorities, and what barriers are making it tough for institutions to keep up? Like, what are these key challenges that you are hoping to solve at the state level?
Well, I love the poll you all started with because and I wrote two things down, limited budget and the off-campus commuter students. And the budget is huge. And I think that is something that really prevents some campuses, especially smaller campuses, from being able to offer such resources. They cost money. And it's important to assist these smaller schools and all the schools across the state, and so that's how we got here. But we did some surveys across the state and meeting with our counseling center directors and our counseling center staff across the state, and that's the first part of this. That's the beginning. I think, and all states need to consider that. This is something years ago that we weren't doing, and that's something HEPC started in the behavioral health sciences is getting all the counseling center directors together, getting the staff together, meeting, talking, doing surveys, asking questions, doing campus visits. And so through this gathering of information, we found that there's a need for expanded crisis and support for students on our campuses. Another part of our health sciences division at HEPC is focusing on workforce shortages. And there is a behavioral health professional workforce shortage across our state in West Virginia. And so that also bleeds over into our higher education campuses that are, some are short-staffed, some have one counseling center staff member. And then also increase rates of mental health and substance concerns. West Virginia isn't the only state that's been seeing this. But what are we going to do about it? And how do we help that? Looking at our schools, we have 5 schools across our state that do not have a campus counseling center. We have 4 campuses and 4 directors that are dual directors. So they're a director over accessibility as well as counseling. And then we have six campuses that have one counseling center staff member. And so we were looking at this and examining this and how can we help our counseling centers and our behavioral health staff, and also how can we better help our students. So every 2 years, West Virginia participates in the National College Health Assessment, and it really provides excellent data and information for us all to learn, what's going on with our students across our state, with their health, with their wellness, again, with their mental health. And so, in the most recent survey, which was last year, we had 2,800 West Virginia students that participated across the state. And what we found is that 83% of students said that their campus thought that they were doing well with student mental health and well-being, and that their campus held that as a priority. And so we do this survey every 2 years. We've been doing this for about 10 to 15 years now, and off and on throughout those years. And that number has improved from 53% from the previous survey. And so the students that took the survey last year felt that their campus was doing great things around mental health. So that's a plus. We also found that on this assessment, they provide a loneliness scale. And we know that we want to assess our students' loneliness. Are they engaged? How are they feeling on campus? We also know when we look at mental health and behavioral health, hopelessness, loneliness, those are two factors you want to pay attention to when it comes to mental health. And so 49% of our students screen positive on the loneliness scale, and that's 48.5% nationally. And so we're a little bit over that national average of students that may feel lonely on their campus. And so looking at that, why are they lonely? How can we get them engaged? What support can we offer them? 4% of students reported being in recovery. We had 30% of our students that screened positive on a suicidal scale on the assessment. And the national average was 25.9. So our West Virginia students were over that, and that was alarming to us. 2 to 3% of the students that participated in the survey had attempted suicide within the last year. The national average for that was 2.2%. But on a positive, 82% at least somewhat agreed that their campus is doing something about mental health and wellness. And 78% said that they would consider seeking help from a mental health professional. Other challenges that we heard from our directors, our counseling center staff, and just meeting and gathering information was the need to have a flexible care option. Many of our campuses have online education programs. There's many students that are across the United States attending our schools. And also when we're looking at non-traditional schedules, some students may have full-time jobs and take evening and online classes. Many of our campuses have student athletes, which have very different schedules, very demanding schedules at times. And so our campus counseling centers are usually open 8 to 5. And so what happens outside of those hours? And not all of our campuses have or had some sort of after hours service, or an on-call system that some campuses have. Our campus counseling centers reported being overburdened, understaffed, um, not enough money in the budget to hire more staff or to get more resources. And so this is something that we heard a lot. We just don't have the budget or the money. Some campuses didn't have a budget at all, and for their campus counseling center or their mental health, and some campuses had a budget, but just felt that they had more needs. And so just helping those campuses be able to afford, is another reason why we began to look at what can we do statewide.
Thank you, Candace. Yes, this is definitely a callback to the results from the poll speaking to, more non-traditional students. I think that's everyone's seeing that nationwide. I really like that the state focused on not only supporting students but supporting their staff with
Mhm.
addressing these needs in the counseling centers. So important that the staff is not overwhelmed or overburdened as well.
Mhm.
Candace, another question for you. How do you, if my slides will cooperate here, how do you approach and coordinate at the state level, but make sure that each campus can tailor support to their own needs?
Well, we have been, and when I was a counseling center director in the state, in the past, West Virginia's done very well over the past 5 years of getting all of us together, convening the counseling center directors, the staff, and asking questions. And so I think that's a big part of it is getting with your directors and your staff and asking questions and finding information out. And so this is how we found a great bit of that information um, to be able to help our campuses. And so when we're looking at a flexible, scalable, access focused model, um, we gathered all the information and these are the goals that we came up with and we looked at each institution and that's something that we've been able to do with BetterMynd is to tailor the marketing and the services to each campus. What does each campus need? How many credits do they need? And we're also looking at the data that we got from last year from our pilot schools. And how was the uses on each campus? And so we're able to examine that and determine what's best for each campus. And so providing the online therapy sessions, providing the 24/7 support line, and providing the wellness workshops that hit all of the areas that we needed. All of our campuses are different. Some have more non-traditional students, some campuses are residential, and they all have different needs. And so offering all three of these options and services for our campuses really is able to tailor different services and options for each campus. Another big part that really stood out to us is being able to roll over credit. So any credits that the campuses do not use for the current academic year, they roll over to the next academic year when a contract's renewed. And so looking at budgets and looking at savings, we need to look at, what can we get, for the best price and what can we get for our campuses that's going to give them more services. And one more part that I do want to add now that we have our campuses on here, there was an examination prior to getting this started in our onboarding of our campuses of looking at, what is the student body of each campus? And I know BetterMynd looked at and examined, how many credits could they possibly need? And it also works that you can add credits on as you go. And this is something, I think RJ will discuss with Northern. And it's just really flexible in that sense. And that's really helpful for our campuses, and it's easy for them to use. We don't want to give them this new thing that's cool, but it's like has all these steps and it's daunting to use and it's difficult and just add something. So, it's been really great for our schools. Great pilot.
I remember that actually when the 8 institutions launched, we made some assumptions about what the number of sessions needed would be for each individual institution based on their enrollment size, whether or not they had a counseling center. And it was interesting to see the differences throughout the year. So, we might have thought, oh, this campus will need 100 sessions, and maybe they needed 120 or 130, and some other ones needed less. So it is very individual.
Hmm.
And I think that's, the pilot was built on flexibility and providing that background data. So campuses could have access to the sessions they needed, the 24/7 line, the workshops, and they could allocate based on their own philosophy of care. And I think both RJ and Anna are going to speak directly to that. And then roll over anything that is unused so that this first pilot year really acts as an example for what we can expect in the future.
Yes. In this next academic year, we were, just fortunate enough to be able to have more funds to do a second year. And the credits that we didn't use for this first year have rolled over. And now we have 16 schools. And so those credits can be rolled over. And so, we're really excited for this next upcoming year and to add more schools and be able to have more resources for our students.
That's great. Candace, this initial group of 8 institutions were all so unique. What are you learning about student engagement and utilization of services?
It was really interesting to dive into the data, and we get monthly data as well as from each campus, and then that's all combined together so we can look at it. And so we were able to look at each campus to see, who used more of what, and was just really interesting. So just a couple of things. There was one of our 2-year colleges used 10 times more online therapy sessions than the cohort average, and this was a college that did not have a counseling center. So that showed that, there is a need for these resources on college campuses. We saw that community and commuter colleges had more high engagement, especially the non-traditional and working students. And so, that's a group that we have to focus on, not just our typical student age students that live on campus, but looking at our non-traditional and working students, what services can we provide them as well? And so the flexible services worked really well for that group. There was
That's
also one rural 2-year college that did not have a counseling center that saw 4 times more engagement with the well-being workshops than the larger institutions. And that's something that we saw as well. Our community colleges and our commuter schools utilize the well-being workshops more than our larger 4-year universities. It was
that's
really interesting.
great. Yeah, I think we'll dig into that with RJ and Anna even further. And one other question for you, Candace, and that is, what are the measurable impacts, or how are you measuring success after this first year?
We really examine the monthly data. We meet with our counseling center staff and our directors monthly, and we also have check-in meetings with our schools very often monthly that utilize BetterMynd and that were in this first pilot. And so we received feedback from them. I was also able to attend our student leadership uh, conference this summer, and that's a leadership conference with all of the student government association students across the state, and they were able to give us feedback and different cool ideas that we didn't even think about. And so we've been able to, in a variety of ways, examine how this has worked on each campus, how it's been beneficial, what can we do better. And so we've really been able to examine a lot of that and use that for this new year.
That's excellent. So the state level, that allows you to meet both the student need and the institutional need. I
Yes.
really appreciate you. Thank you for sharing the West Virginia perspective on providing the mental health resources to your campuses. Now I want to pivot and hear from our campus leaders. We have one partner from a campus with no counseling center, where faculty and staff are filling the gaps and finding creative ways to engage with students, and another from a campus with an established counseling center looking to extend their reach and ensure that every student has that right level of support. So we want to hear the real stories from these 2 different campuses with their needs, challenges, their strategies. Anna and RJ, could you each share a bit about how you see the partnership fitting your campus and students? And I'd love to start with Anna.
So here at Concord, we have a large amount of student athletes. In fact, over 60% of our residential students are student athletes, and they have a very demanding schedule. And part of the problem with that is because they have a very demanding schedule, they also have more stress. So they also are students who need extra support. And we found that a lot of times our hours do not fit very well with their schedule. So Better Minds has been a true blessing in that aspect. We also are continuing to grow our online services, and we can offer telehealth through our counseling center. However, if the person is not in state, we can't provide telehealth services to someone out of state. So we really didn't have any services at all for our online students who are out of state. So this allows for our online students who are out of state to receive services. And then again, we also have we have a lot of non-traditional students who have a job and have family to take care of and have a busy schedule. And we also have students who just feel more comfortable speaking with someone online rather than in person. A lot of times that's how they're communicating with each other is online. And I think COVID really spurred that practice of people meeting and communicating online. And so I think that some people are looking for online services through online counseling. And I think it's something that students are interested in. And so to be able to provide them in person opportunities for counseling and then also online opportunities for counseling, it's just really been a game changer for us. I feel like we've been able to reach a lot more students. And it actually, for us, it came at a very good time because shortly after we implemented BetterMynd, one of our counseling positions was vacant. And so we were down one person. And then shortly after that, our counseling center director announced her retirement. So she retired at the end of the fall semester. So this really helped us reach our students in a very difficult time where we were down significantly. And then it also helped our new counseling center director who came in and hit the ground running and did a fantastic job, but she was very overwhelmed because we still didn't have that vacant position filled. So she was doing a new position and doing it on her own. And this allowed her to feel supported as well and not so overwhelmed by the waiting list that we had. One thing that it helped with me is having that 24/7 crisis line. As a dean of students, you worry about your students and having that crisis lines that the student can call and then they will contact me or the resident director on duty to make sure that that student's needs are being met in an emergency situation. I mean, to me, that's priceless because peace of mind that your students are getting the care and getting urgent care if needed is really something that you really can't put a price on.
I love that you called that out. I mean, staff support is, just as important as access to counselors and to be able to provide those two things, and especially the timing, that allowed you to see the folks that wanted to be seen in person without your staff being completely overwhelmed. Thank you so much. RJ, I'd love to hear from you. How has the partnership fit your campus and students? And here is just a snapshot of RJ's campus.
So we have a large impediment in the sense that we're a tri-campus. We have a campus it's centralized in Wheeling. We have a campus an hour north and a campus in another direction for another hour. So if we were to ever get the budget to quote unquote hire a counselor, it would be really difficult to provide accurate and consistent services to our students, because things like anxiety don't just show up on Monday, Wednesday, Friday. And also the hours, right? If a student was in crisis on campus A, but the counselor had hours on campus B, how would that work? Could we Zoom? Would that be effective enough? And things like that. So it was a conversation that came up very regularly. Could we do this? But every time we looked into it more, the only answer was we would have to hire 3 counselors, which we couldn't even come up with the budget for 1. So when BetterMynd came around, it was great because it was the same service that could be spread across all 3 campuses. There is no difference in the service that we're offering campus A, B, or C, regardless of the size of the campus, the amount of foot traffic per campus or anything. Everyone's getting the same amount of care. They're all dialing into the same system. Another thing that was really, really helpful for us, and Anna mentioned it earlier, we have a lot of online students. Distance education is almost like its own campus at this point, right? It's an intangible campus, but that doesn't mean that the students that are enrolled there are any less important. We have many out-of-state students now because we have I want to say we have at least 3 or 4 programs that offer everything online at this point. So obviously we have students from out of state, and that could also become a problem. How can we offer counseling to an online student who's 3 states away when we have a physical counselor who only comes in 2 days a week on one campus? So it was really difficult. We really were kind of backed against the wall, not really sure where we were going to go or what we were going to do. And when this came across, it was really easy to just say, yes, this is definitely going to help. This is going to be able to fill the gap that we have and probably fill in some cracks that we haven't even realized exist yet. And it has. The engagement has been really high. I've heard students talking about it with each other. I've heard faculty and staff talking about it with each other. And like we'll discuss a little bit later, yeah, it's really fit the community model that we strive for here at West Virginia Northern Community College.
That's actually a perfect segue to my next question. You're on the front lines building awareness and trust. And can you share some of the strategies that work to build trust and make students see these resources can be for them?
Sure. Switch to that next slide, and I'll go over. There we
Yeah,
go.
you got
So, like I said,
it.
with the community model there, we had some things that we had tried in the past, and we tried to get engagement up and things like that. With BetterMynd, it was just an all-in model. I do think that BetterMynd themselves allowed that to be that way, but we're all in. Like I said, all 3 campuses are endorsing this. All student services individuals are aware of it and endorsing it. I have multiple people on faculty and staff aware of it, endorsing it. I have other students who have left feedback and are endorsing it for other students and things like that. It's not a situation where what is it that we have, like a thing like that, like someone will hear you ask that question and answer it for you on any of our campuses at this point. We've put all of our resources together in one place on our website. BetterMynd is included in that. And anytime that you link to anything, it's not like you're getting just BetterMynd over here and just this over here. Everything is all together now, and it just works. It's a much more seamless process than it has been in the past. And like I said, our resource visibility, we've worked with marketing, but BetterMynd has worked with me and our marketing team to provide things like logos, information, anything that we wanted a PDF or a picture of that didn't exist. Our marketing would either create it or BetterMynd would create it for us, or we'd work together to create that. And those resources have just been everywhere. We put them on all 3 campuses. They're available everywhere. Everyone sees the same things. We're not changing it semester after semester or month after month or anything like that. We recently got some syllabus language approved. So the syllabus template now references that we have student coverage, and that it is number one, that it's free. That's a big deal, right? You know what I mean? Like putting that out there too. And that's part of the resource visibility as well. This is a free service. You're a student here. This is yours. Like, make it your own. Do what you need to do with it when you need to do something with it. And the syllabus language just refers back to that, right? Here is how to research, how to reference to get logged into BetterMynd, start your account, and start having counseling right away. Our cross-campus promotion. We are starting things in Wheeling, which is our bigger campus. It's easier to get things done there. It's easier to get people to help and things like that. And instead of trying to do everything across all campus at once, what we've been doing is piloting things on our main campus, and whatever works, and we're putting that out to our other campuses. So we're not doing something that's not really working on another campus, even though it doesn't have the same level of engagement on the smaller campuses. We're taking the things that work on the big campus to the smaller campuses, and it's working. We're not doing that thing where like sometimes you want to get all your resources in the bucket before you like dump the bucket. As soon as we get anything in the glass and we think it works, we're pouring it right back in. And student incentives, we're doing a lot of things currently to try to engage the students and get more people signed up for BetterMynd. Like I said, we're talking about it in the syllabus, so that's going to be a conversation that faculty are having with their students on syllabus day. We have had students come in and say, like, I was thinking about doing that, but I haven't done it yet. Hey, let's go right up to the computer lab right now. Or you got your laptop in your backpack? Here, come into my office, sit down. Let's get you signed up. Let's get you logged in. I'll even walk you through the dashboard. It's pretty cool. Let me show you how it is cool, right? We have started to do a lot of social media posts and things like that. We do a lot of lunch and learns with free pizza. And we've kind of combined those two ideas to say things like, everybody loves free pizza, right? You would eat pizza if it was free, even if you weren't hungry. Well, we have free mental health resources for you. So why are you not using them, right? You know what I mean? And that seems to be pretty popular and has caught on with a lot of people.
I love that. Y'all should check that out on their social media. It's a cute video. I saw a question in the chat that I wanted to ask before we move on to both Anna and RJ. Gail asked, do either of your schools have a peer support program as part of your mental health resources?
We don't, not at Northern. We currently don't have any PRSS or anything like that. It is something on the larger list of things that we would like to look into, and see what we can do. The other big issue that we particularly have with that, if anybody's familiar with the Green Bandana project, we tried to do a little bit of that at one point, but the problem is in an ideal situation, our students are gone in 2 years, right? So you kind of come in that first year, get your feet wet, right? And then now you kind of decide, oh yeah, I want to get into things and stuff like that, like student government or anything like that. And you do in that second year, and then you're gone. It's over and it's done. So it's been hard to try to come up with a plan with that for our particular students.
So here at Concord, we don't specifically have peer program that's based out of the counseling center. However, our counseling center works with our existing peer programs, such as student support services. And also we have peer mentors through our University 100 classes. And so our counseling center meets with those peer mentors to talk about counseling services, and also our resident assistants. So our counseling center also attends our resident assistant training and provides information about counseling services and BetterMynds. And then we also are going to require all of our resident assistants to give information out about BetterMynds for their first meeting, their floor meetings that are required, and to put the phone number for the crisis line in their phone at that time. And something we did start was a student mental health advisory board, where we meet with students on a regular basis and talk about students' needs. We have a large social work program here, so we have a lot of social workers who are interested in attending that, psychology majors who are interested in attending that. So that's something that we're going to be focusing on at the beginning of this semester as well.
All right, great. Thank you. And one other thing I'll just add there is when these types of questions come up, if a campus partner comes to us and asks about that, something we routinely do is we reach out to the folks that we know in our campus partners do this sort of thing and do it really well. And we best practice share as much as possible, because it can be hard to find folks who are doing exactly what you're doing, or connect with the folks that are trying to affect support the way that you are. RJ, one more question for you. What advice would you give to people that are in a similar situation, building out trust, giving these new support options? What advice do you offer?
Well, starting off, don't give up. It gets hard. Trust me. I've hit my head against the wall several times. Before BetterMynd came along, I really wasn't sure what was going to take the place or how we were going to fill those gaps or anything like that. But keep looking. I know the search can be difficult. I know there's a lot of things out there that are overwhelming. Some things are really expensive, but there are things like funds and grants and other things that are available. And those grants and funds are looking for you as well, right? So if you just put yourself out there, you can make these connections and things like that. And just the longer I've been part of this larger process with this kind of stuff, the more connections I'm making, the more things that I would have lost out on had we given up or not continued to persist in trying to build and maintain these services for our students. Again, I keep coming back to that word community. Again, we are a community college, but we like to own it. And one of the things that you can definitely see is in the microcosm of all of this is this again, it's not just me on an island here at Northern doing these things. I see Anna and I see Candace in meetings outside of this. You know, we're working together. We're like, as Christy shared earlier, we're working together. We're sharing things, right? We came up with a crisis policy here at my university that was shared with the other campuses in the cohort, and they adapted it for their own campus. I borrowed language from Marshall University to start something else over there, right? I was in connection with Candace for something else, right? So there are a lot of people that will work together, and you'll see the same people over and over again. But I think that that's a good thing, and BetterMynd is part of that community as well. Like they mentioned earlier, right? If something works, they're not just holding on to it. They're saying, "Hey, tap you on the shoulder. Hey, over here, Anna did this thing and it worked. I don't know if it would work for you as well. Check it out. If not, then no." Or, "Hey, this seems cool. Do you mind if we like?" Punch it up and make it not seem like, just the rantings of a chaotic mind. Yeah, by all means, and it looks great. We're engaging students directly. We're involving students in spreading the word. Other students are telling other students. And we're trying to do it that way. We do send emails, and I saw another question in the chat, like trying to overcome the burnout from just sending an email. We try to let the students kind of talk among us. Not to say that we don't send out reminders and monthly wellness letters and things like that, but yeah, there is a lot there. So by having things like we don't have bulletin boards anymore. We have televisions that like show things like PDFs and things like that, and I think that really remind students constantly, right? You know what I mean? Because not all students are in every single building. So having those spread across our multiple building campuses has really worked for us. And also start small. It kind of goes back up to the don't give up. Northern was not at the level that we're at now 5 years ago, right? 5 years ago, when I kind of started this journey of us trying to find some way to provide for our students, um, we didn't have half of what we have now, right? Now we have things like a wellness center, and our wellness center isn't a counseling center; it's just an informational reference zone. So if a student has has a question, right, instead of sending another email and blasting them, they can go down there and just sort through the information themselves and things like that. Or like, hey, to another student, did you check out? Oh, I happen to know that they have information on that in the wellness center and things like that. But start small. Like don't wait until you have like 10 things that work, right? Keep doing the one thing that works until you find a second thing that works, and then apply the second thing and then the third thing, right? Because if you just sit on all this stuff, it's just going to expire, right? It's not going to work by the time that you go to implement it and things like that because everything changes so fast.
I love that, RJ, especially the piece about starting small and engaging with students. They'll test out things and they'll tell you what works and what doesn't. And just to add on to the insights that RJ shared, I wanted to provide this. You can scan this QR code and get a mental health best practice checklist for campuses without counseling centers. It really offers a holistic view to help build out your strategy. These are the kinds of things that my team and I talk to our partners about on a daily basis. And, there's many different options. Select the 1, 2, 3, or more that work for you. So now I'd love to pivot and hear from another perspective. Anna, from a senior leader's perspective, how has this new strategy supported Concord's broader student success strategy? And you spoke to it a little bit earlier, but I'd love to dig into the impact you're seeing with your athletes, your online only students, and your non-traditional students.
So, as most colleges, we are striving to improve our retention, not just to keep our campus going, but for the students' sake. We want them to be successful. We want them to come to college and walk across the stage, get their diploma, and go out and change the world. And a lot of times they're dealing with so many outside issues, and they need help with that. They need some additional support. So, student success is our, main objective here, and this really helps with that. And I think it not only gives us a peace of mind, it also gives the students a peace of mind of just even knowing that help is available if they need it. So they may not need it right then, but to know that it's there. I've incorporated into my speech that I give to our incoming freshmen at orientation that, we have counseling services, and I talk about BetterMynd, and I also focus on the fact that mental health is health, and they don't have to be in a mental health crisis to benefit from counseling center or Better Minds. They can just be having difficulty with homesickness or having trouble with the transition from college, from high school to college, and that it's there to support them with things like that. And also a mental health crisis if they were to have that. I mean, this is an age group where significant mental health issues presents itself. So we do see students with mental health crises, and if we can do anything to help them to be able to manage that mental health crisis and to stay in school, that's our main goal, is to help students to stay in school and be successful.
Yes, absolutely. How are you defining your return on investment for the mental health initiatives that you are launching?
So I said before, you really can't put a price on a student's success. I know that we want a student to do well for themselves. And then when they do well for themselves, they're not only doing well for them, they are making a difference for their family, for their siblings, for their future children, and for their community. So, we see this as a domino effect. So if we help a student in crisis, and then they also share that information and share the benefits of it to others, then, the reach is far and wide.
Yeah. And I love that because, I think a lot of us get into this because we want to help those individual students. And it's just so heartwarming when you see that piece of feedback that says, I couldn't have done this without the resources provided by my school, or I stayed because of this, I had this support. And it's just makes us all feel really good that we get to do this kind of work. I really appreciate the insights that you have shared and how the model works for students on your individual campuses, both with a counseling center, without, multi-campus experiences. And, the student experience is one piece of the puzzle. But we know that there's a lot that goes into it to manage these things. And RJ, Anna, Candace, you are all involved in the back end work, the day-to-day administration, looking at the data, the quality of the partnership that we build with you. And that can all make or break long-term success. So I would love to hear from RJ, Anna, how has the administrative experience been for you?
I'll go first. So, I think it's been great. Like I said, BetterMynd has fit like a puzzle piece into the narrative of community that we try to maintain. I feel like I'm on a team here. I feel like I can email someone and get a response, and not wait for a meeting, right, to have to bring something up, for example. It's no surprise to me to get a random email, like I said, where someone says, "Hey, this seemed to work for someone else. Could you use this?" Or even possibly, "Hey, I remember when you said you were working on this. This came across my desk." And it just seems like it's just another part of another team that I'm on. And so I feel like that has been great alone. The feedback from the students has been incredibly positive. The feedback from my other staff and faculty has been incredibly positive, more so than things that we've tried in the past. And I do really think that has a lot to do with the dashboard and just the way that things are set up. You click, you create your account, and you're in. There's not like a waiting period. There's not a phone number now you have to call, a code that you have to put in, anything past just logging in, and you're just there. There's the dashboard. The dashboard is really professional, really cool looking, much nicer than some things that we've offered students in the past, which I think helps build trust in the fact that it looks like such a polished, situation or service and things like that. So yeah, I think the experience for us administratively has been great because again, we have no counseling center, so this is just a boulder that we kind of pass from shoulder to shoulder between a handful of us because we don't have anything there, and BetterMynd has just come in and been another shoulder to hand the boulder to.
Well, I would like to speak to the fact of how user-friendly the platform is. One thing that when we first started, I was a little overwhelmed with, oh, how am I going to be able to get in here and use it? Because I wasn't the main person who used it. But when we had that period of time where we didn't have anyone, I was a person. And so when I got a message saying that the student needed additional counseling sessions, I was like, oh my gosh, I've not done this before. And I got on there and it didn't take me any time to figure it out. And I'm not the most tech savvy person, so I was able to figure it out very easily. Also, I had the new president of Concord ask about BetterMynd, and she wanted a report. And so I never ran a report before, but I got on there and was able to easily run a report. So to me, I think that that is really a huge benefit that is just so user friendly, and coupled with the wonderful support system that you have set in place. I think that it's something that I don't have time to spend a lot of time trying to figure something out or contacting people to try to maybe do another training. And so the fact that it's user friendly is it's really a benefit that I see.
Well, it's great to hear that. Well, I appreciate the perspective that everyone has shared, the two very different campuses and how they can still stay aligned with their own philosophy of care, which might be different. And just to share a little bit about how BetterMynd partners with, we don't think of ourselves as just a vendor. We're a collaborative extension of your team. So we listen first to what each individual campus needs and how they currently work. We analyze the needs of the campus. We know that most students will not or do not currently utilize mental health services until they see that value provided by those. So with this flexibility of a session bucket, you pay for what your students use. So there's no fixed cost per student. You're not locked into paying for your entire student body. You're only paying for the folks who actually use it. And I think something that they mentioned earlier, this team mentioned earlier, was well-being workshops being a good entry point. So if people aren't ready for individual sessions, they can kind of break in with that and start to learn more about wellness, mental health, and topics like that. You as a campus get to choose how students will access services, how many sessions they can access, and the goal there really is to meet your individual philosophy of care and your individual workflow, and it's going to be different based on how your institution functions. Then we work with our campuses to create branded toolkits. So it's going to look like your campus. That means Concord's branded toolkit looks different from Northern's toolkit, looks different from every other toolkit. And we run these joint awareness campaigns using multiple channels. So I think speaking to the point of I think it was survey what was it? Survey burnout. I mean, students start to ignore things if they get the same sort of messaging all the time. So things like syllabus mentions, digital platforms, texting, peer ambassadors. Students see things in a variety of ways, and that way you meet them where they are. You meet them at their entry point. And then you can monitor everything in real time through these transparent dashboards that RJ and Anna just mentioned. So I often will get on a call with a partner, we'll dig into the dashboard, we'll grab that data, and we'll look at what exactly is happening in real time. That allows the campus to change their approach as they go. So you may launch with one thought and see how the utilization goes over that first year, and you may make changes the next year. That's really all about staying in sync for the campus priorities, collaborating on strategy, troubleshooting things together, and celebrating successes. One of my favorite things to do is to send that email to a campus administrator that says, congratulations on the 100th session, successful session, or look at this fabulous feedback that your student gave and, commended your campus for even providing this to them. Those are the things that we really love to celebrate together because it is a partnership. Ultimately, our approach is about aligning to you, your campus culture, and your students. I have one question for Candace. I know we're running close on time. I'm just curious if you can tell us what's next for West Virginia.
Well, continuing to work together and meet with our counseling center directors, our counseling center staff. Um, we have been offering monthly lunch and learns for our counseling center staff, as well as our behavioral health academic program faculty. So that's another way for that states can get together when it comes to student mental health and, getting together not just the behavioral health staff and the counseling center staff, but also faculty. RJ is faculty at Northern. Another thing that we want to continue to do is to work with our colleges and universities across the state to offer mental health events and conferences. Um, RJ at his campus, Northern, just last week had a mental health and wellness drive-in event. West Virginia State University held our suicide prevention conference last year for this academic year. So that's what's next, is continuing to offer these services, continuing to connect, and continuing to collaborate.
And launching at 8 additional schools this year. We're right in the middle of onboarding them, and I'm excited to see their results as well. One last thing, if you are interested in a success guide on how to choose an online therapy provider, I just popped a resource up there. Take a screenshot of the QR code to download that. It's going to ensure that you can meet both the institution and the student's needs as you make your decisions. Thank you all so much for joining us today, and we hope to see you at the next event.